Hi everyone, now I am going to introduce for our first video project. First and foremost, we need to understand why we need to learn about tapping technique. Mastering tapping technique have become an important tool for everyone and not only for healthcare professionals like doctor or nurse. It is because tapping technique is our first medical treatment. If we have the knowledge of having first medical treatment knowledge, we can help our patient or our future students when they are having accidents or sport injuries. In this project report, we have demonstrated some tapping technique for different body parts which can help us in our future emergency situation. The upper body part, we have focused on neck, back and wrist part, and for the lower body part, we have focused on knee, calf and ankle part. All of these body parts are having high possibility to injure when they are having their sports activities. So as a future teacher, we need to have this knowledge of tapping techniques to help our future students or patients in order to have a better outcome if they are having their accident.
Hello and Assalamualaikum everyone. My name is Nourishmin Adriana binti Norisham and I'm going to explain about the general kinesiology taping for neck pain and neck stiffness. So as for the reminder, first is ensure every corner of the tape is rounded because rounded corners help to prevent the edges of the tape from peeling off prematurely, because if the corners are left sharp, they may catch on clothing or skin, leading to discomfort or causing the tape to leave. And next is only apply to dry and clean skin, because applying the tape to clean and dry skin ensure proper adhesion and prevents the tape from coming off prematurely. And if the skin is dirty or moist, the tape may not stick well, and it also reducing the effectiveness of the tape. And the third one is we should not apply to a broken or frail skin, because the tape should not be applied to the areas of the skin that are damaged or fragile, because doing so can cause further irritation, discomfort, or even injuries. So it is important to assess the condition of the skin before applying the tape to avoid the areas with cuts or other skin conditions. And the materials that were needed were only one short strip of the kinesiology tape and one wide strip of the kinesiology tape, and also a scissor to make one strip becoming a wide strip. So first, all you need is one long strip of the kinesiology tape and one short strip. So here I show you how to cut the middle of the long strip and turn into a wide strip of the kinesiology tape. And next, start by placing the strip, which is the Y shape, without stretching it at the base of the neck between the scapula. And before applying the tape, please make sure the person tilt their neck downward and to the left to stretch the muscle, and same goes to the right side before placing the Y-shaped tape. Don't forget, this should be done without stretching the tape. And lastly, after return your head to a normal position, now prepare a short strip of tape. So place the tape with a 50% stretch directly over any painful area in the neck. Secure the tape without stretching it to prevent it from pulling too much.
And as for conclusion, there are a few benefits from this. So first is pain relief. So this tape is believed to help alleviate the pain by providing support to the muscles and joints, which can reduce the strain and inflammation. So the tape's elastic allows it to gently lift the skin, which may help improve the circulation and reduce pressure on pain receptors. And next is provide support. By providing the support and reducing the restriction on movement, the kinesiology tape may help improve range of motions in affected joints and muscles. This can be especially useful for individuals recovering from injuries or dealing with chronic conditions that affect mobility. And the last one is it can help to reduce swelling, because the gentle compression provided by the tape may help reduce swelling by promoting the lymphatic drainage and improving circulation. So this can be beneficial for individuals dealing with acute injuries or chronic conditions characterized by inflammations. And that's all from me. Thank you so much.
Hi and Assalamualaikum Madam Najwa. My name is Shirin binti Zainuddin. I will explain and show you a demo about general kinesiology taping on knee. The materials that we need in knee taping is 2 short strip of kinesiology tape, 2 long strip of kinesiology tape, and a scissor to cut the tape. For the safety precaution, Please ensure that the tape is rounded, do not have sharp sides to ensure the safety of the patient. Next, only apply to dry and clean skin. Make sure the skin is dry and clean. And lastly, don't apply to broken or frail skin. If you identify that maybe, for example, the knee is broken, do not apply this method. This is the steps for knee taping. Firstly, the patient sit on the floor and slightly bend the knee. Keep the knee in this position throughout the treatment. Next, start by applying the first tape. Apply it from the inside of the knee cap. Repeat with the second tape but on the side of the knee, which is in mirrored position. And lastly, apply the third and fourth tapes under full tension and partly overlap the first and second tapes. Next, in the end, rub all the tapes down firmly. The conclusion for this knee taping is it can provide additional stability and support, especially when we do activity like running. Next, it can activate our muscle. Because sometimes we underuse our muscle and it become weak, so it can support the weak muscle. And lastly, it can help to reduce swelling.
Everyone, my name is Shafiza and now I am going to share to everyone on how to use kinesiology tape to strap an injured calf. Before we moving on to the steps, there are some reminders for everyone to remember. First, we need to ensure every corner of the strips are rounded to prevent them to catching on the clothing. Secondly, only apply the tape to dry and also clean skin. Lastly, don't apply the tape on the broken or frail skin. We will need use 2 long strips and 1 short strip. First and foremost, we need to measure the length of the tabs that are needed from the top to the bottom of the calf. For the short strip, we need to measure the width of the tabs that are needed. Now, for the first strip, tear backer paper 2 inches from the end to create our first anchor. Place the anchor just above one side of the ankle with no stretch. And also, don't forget to cut round the corner of every strip of tape to prevent them to catching on the clothing. For the second long strip, we also need to create an anchor at one end. After that, we need to repeat the same technique with the second strip next to the first, on the other side of the calf. Peel the baker paper from the middle segment of the strip. Apply tape with light stretch along one side of the calf muscle. Now, we need to prepare the short strip by removing the middle section of backing paper. And then we stretch the short strip of the tape to 50% and apply directly over the point of the pain. For the last steps, we need to rub the surfaces of the tapes to activate the glue and to make sure the tabs have completely applied to the skin. In conclusion, kinesiology taping can offer sparks, burst calculation, and also relieve discomfort when your muscle and joint work together when we are doing any sports activities.
Additionally, kinesiology taping also can work as a tool to enhance pre-proprioceptions, aiding in better movement and also muscle activation. But not least, most of the athletes are using kinesiology tape to improve their performances and also to prevent any injuries when they are doing the sports with using kinesiology tape. Last but not least, these are the three main resources where we can find all of the information about our rigid taping information and also our calf muscle information. Bye!
A very good day everyone, my name is Nilasha and now I will be giving a brief explanation on how can you apply the kinesiology taping if you're experiencing any swelling or injury on your ankle. You just have to follow 3 simple steps. So before I brief all of you on the 3 simple steps, you need to prepare the materials which are necessary for it. Number 1, you will need a scissors to cut and also have the measurement according to how you want the taping to be. Number 2, you will need 2 long strips of the kinesiology tape and also 1 short strip of the kinesiology taping. So now I will explain the first step. Firstly, you should take the tape, the first long strip of the kinesiology tape, go towards top of the leg basically and go until the bottom of the leg, bottom of the ankle, and measure the length of the whole leg. So it has to follow according to the measurement starting from the top until to the bottom of the ankle. And then cut it according to the measurement and then tear the back section of the paper as you do. So whenever you stick the tape, you will have to tear it. And then once you have already taped it on the leg, you will have to rub to activate the glue. Second step is you have to take the next long strip of the kinesiology tape, paste it on the first tape and bring the tape on top of the leg. Again, rub to activate the glue so that the tape stays on the ankle side. So first step, start from the top until to the bottom of the leg, basically the ankle that we are focusing on. Second step, place the tape it on the first tape, touching on it and bring it on top of the leg so that the tape is pasted, like basically taped on top of it on the straight side, so it has to be straight. The third step, you will have to turn over the tape, you will have to cross over. So starting from its initial position, turn the tape and then bring it across in front of the feet of the leg, basically in front of the ankle. Bring it up and make sure it comes to the initial position of where you have placed the tape. So this one you will have to use the short strip, the short kinesiology strip tape. So this is how you would do the kinesiology taping if you are having any injury, or let's say if your ankle gets any swelling. So these are the steps that you should follow as a whole if you are doing anything for your ankle. These are the 3 simple steps that you should follow for your kinesiology taping. And that's all. Thank you.
Assalamualaikum and a very good day everyone. My name is Siti Asha binti Abdullah. Now, I'll be sharing a brief explanation on how to rigid taping on an injured wrist or to support the wrist. You just have to follow this simple, quick and easy tutorial. Let's begin with the material which are necessary to successfully do this. Materials required for wrist taping are 1 long strip of rigid tape and a pair of scissors. Oh, and this is optional, which is under wrap. This is just for a protection so that we don't irritate the skin. Safety reminder alert: before we start to wrap, it is crucial to remember to only apply the tape to clean and dry skin. Additionally, using pre-wrap or skin protection can help to prevent skin irritation. And lastly, mastering the proper technique is essential for effective taping. So now, let me show you how to wrap an injured wrist or wrist support. Before starting, ensure the skin on the wrist is clean and dry before applying the tape. The first step is, the rigid tape must be placed on the inside of the wrist. I am aiming for the soft, fleshy area between the bones of the hand and lower forearm like so. Next, make sure that the tape is centered and positioned evenly onto the wrist carefully. Next, Start wrapping the tape under the wrist. Then bring it up and over the wrist joint, attaching it to where we started earlier. This is because this initial wrap provides a secure base for further taping. Now, wrap the tape around the wrist by overlapping each layer just slightly to provide support. Safety reminder to not wrap the tape too tight on the injured wrist, allowing for comfortable movement. As you wrap, use your fingers to smooth out the tape and ensure it sticks firmly to the skin, and make sure to smooth out any wrinkles or fold in the tape to ensure a secure fit. Once the tape is applied, check for any signs of discomfort, swelling, or restricted blood flow. Ensuring that the tape feels supportive but not overly tight is important for the patient's comfortability. Easy, right? Do you know that rigid taping actually provides stability, reducing the risk of injury and supporting proper alignment during activity. It also assists in correcting wrist posture, promoting better alignment, and reducing strain. Rigid taping helps alleviate wrist pain by providing compression and support. With rigid tape, it can support weak or injured muscles in aiding recovery and minimizing further injury risk. Rigid taping also helps to prevent wrist injuries by stabilizing the joint and reducing excessive movement. I hope you gained something from this video. Thank you so much.